Italy's health ministry is asking government advisors to evaluate new World Health Organization recommendations saying that people with COVID-19 can come out of isolation before they test negative for the coronavirus. The WHO last week said patients who spent 10 consecutive days in isolation with symptoms can be released if they are then symptom-free for at least 3 days. People who don't develop COVID-19 symptoms can stop isolating 10 days after they first test positive, according to WHO's revised guidelines. Previously, WHO recommended ending the isolation of infected people only after they twice tested negative on samples taken 24 hours apart. The change is significant given that many countries are grappling with how to deal with thousands of people who are technically infected with the virus but may not still pose a transmission risk to others. The UN Health Agency said it updated its recommendations because recovered COVID-19 patients were still testing positive for the virus weeks later. Despite their results, these patients are not likely to be infectious and therefore are unlikely to be able to transmit the virus to another person, WHO said. Italy, the one-time epicenter of the pandemic in Europe, followed the WHO's previous testing advice, with some people self-isolating even though they felt fine because they kept testing positive for the coronavirus.